Oh yeah, thanks very much. My name's Rich Stockley. Unfortunately, I didn't have enough time to put any bunting up today or anything like that. I had to get my kids to school, and I don't know if anyone else has got children at junior school, but they don't seem to think about what they need to do in the morning, so I was rushing around doing that, so apologies for that. I'm the head of research for Surrey Heartlands Health and Care Partnership and also for Surrey County Council. My background is as a social researcher, worked in the public sector for about 10 years and have been in the private sector before that for about 10 years as well. So I've got about 20 years experience. And one of the things that I've always been interested in is understanding how best to move knowledge from the people who use services to the people who provide them and design them in order to improve their performance and efficiency. Go to the next slide. So I'm sure most of you are aware that prisoners, there are huge health inequalities for prisoners. So they tend to suffer from increased chronic disease, increased infectious disease. There's a lot more mental health issues for people in prison, and this all results in significantly reduced life expectancy. And it's so significant that the Prison and Probation Ombudsman found that the average life expectancy of a prisoner in England is 56, and that doesn't include suicides or where people have died as a result of their own actions. Just by comparison, the life expectancy in the UK is about 81. So 56 is similar to countries like Sierra Leone, Zimbabwe and Somalia, so it is very, very significant. So the background to this project, so we spotted that hospitals really needed to do something different for prisoners, because there were a lot of prisoners reporting very negative experiences of going into hospital for secondary care, and we really wanted to improve that care and also improve access for prisoners to secondary care. And this is quite a big ask to ask clinicians and staff in hospitals to change the way they do things. So we really needed to provide a compelling case that would change people's behaviour in hospital, people who worked in hospital. So when we explain the issues to clinicians, they would generally say they had no idea that was the experience that prisoners had. They really wanted to kind of work with us to change things. So we knew it was kind of the case was strong enough, but how did we make that case? And it's kind of easy to go around to each of the hospitals and talk to people one-to-one when you're just doing it in one hospital or a couple of hospitals in a smaller area. But if you want to broaden that out to an entire ICS or nationally or even internationally, how do you reach such a large audience? So can we go to the next slide? So that there is both national and international policy that states that that prisoners are entitled to equivalent healthcare to people in the community. A lot of the time, a lot of things we picked up, not necessarily from clinicians, but from other people talking, was that prisoners didn't deserve it because they were in prison, but there is national and international policy that says they shouldn't experience that inequality. So it was very important. It's a very important issue. And then if we can go on to the next slide, and this slide's got some builds. So could you just go to the end of the slide? So up in the right-hand corner, the top right-hand corner, there's the method that we use. So I don't really have time to explain the method in depth. But it was a scientific research process, and we had a paper which was published in Lancet eClinical Medicine Journal. Very, very robust engagement PPI exercise. So as I said before, the case was really there, but so why did we use animation as the medium? So there's a number of advantages to this approach. So you can tell people a hell of a lot more in 5 minutes if you're using an animation than if you gave them a written report and asked them to read it for 5 minutes and then to tell you what they've learned. So hearing patients describe their experiences, that's really impactful, to hearing people tell things in their own words. I'm sure everyone in here is a complete convert to that. With this, you kind of really feel something when you see the animation in a minute. You feel what's going on for people, and you have an emotional response which is much stronger, and tends to kind of stay with people for much longer. The visuals help transport people to parts of the journey that they wouldn't typically see. So the clinicians and staff who work at hospitals, they get a feel for what it's like being in prison, a feel for like what it's like to come out of prison and to go to hospital, not just the bit that they see, which happens at the hospital. But the most important thing is that we knew that the data that we collected for this whole exercise was really going to resonate with the people whose behaviour we were trying to change. Because right at the beginning of the process, we sat down with staff and clinicians and talked to them about their experiences of dealing with prisoners. So when we talked to prisoners, it was all framed within the context of the things that were important to clinicians. So we know that all the things in this animation are really important to the people whose behaviour that we're trying to change. And so we're going to play the animation now. So we go back to the second slide. This is kind of a rhetorical question, so something to hold in your mind. So looking at the film, would you say that, you know, we're providing equivalent healthcare for prisoners, or would you say to prisoners it feels more like a form of punishment?
So when I first went in, I went to see the GP and I told them about what was wrong with me, and they agreed that yes, I need to have a surgery. I ended up having the surgery eventually, about 3 years later.
You literally get told an hour before the appointment, get ready now, you have to leave right now.
There's very little information given. Oh, we've got a hospital appointment, that's it. But where are we going? Who am I going to see? There's so much going on in your mind that...
Some prisons only allow one person to go out per day. Now, if there's an emergency that day, that normal appointment gets cancelled.
You'll go downstairs already anxious to know why you're being called downstairs, and then they'll tell you have an appointment.
Trips to the hospital are quite cosy, to say the least. And I was practically sitting on her lap with like my elbow into her breast, because you're literally crammed into the back of a rather small car.
In prison, everything's so slow, and then suddenly you're nearly 100 miles an hour in a taxi, stuck between two officers with no seatbelt on. You know, it's not just purely the healthcare; it's the whole experience involved with it.
Where I'm going, what I'm going for, they don't know. I get into the hospital and then it's like we're working it out, and it feels very disorganised.
It is kind of like passing the Red Sea when you walk in the prison into a hospital with handcuffs on. Everybody gets out of your way. Parents grabbing the kids out of the way and things like that, because I can understand that just seeing handcuffs is not a good look at all.
I'm very aware that sometimes people do complain that we're sitting there, they might make comments.
And they struggle to find a place for me to wait. And what happened is they found like a broom cupboard to where I had to wait, which was definitely degrading. I'm valued less than a normal person.
The doctor addresses the officers first, almost as if they're your parents. And you're the child in the situation. They should be addressing you, not the officers.
If you're having an intimate exam, you're on a chain with handcuffs with an officer next to you. That you may be embarrassed about what you're discussing with the doctor about.
Especially the female side of things. When you go out on escorts, you go out with one male and one female. I don't want them hearing that. I really don't want to be discussing like my lady stuff in front of male members of staff.
They're not covered by a medical code of practice or ethics at all. Therefore, you've almost got an embarrassment. You sometimes don't want to talk about things.
So yeah, it was a bit odd, to say the least. Uncomfortable, and it leaves you feeling like you've wasted a doctor's appointment because you haven't actually said everything you need to say.
I've had appointments where the doctors actually asked the officers to step outside the room. Now, they put you on a long chain and they are literally on the other side of the door. But this doesn't happen in every instance. And I think it's to do with confidence and the doctor's not actually sure what they can ask and what they can't ask.
They might prescribe you something which actually you're not allowed to have being in prison, because there are some medications that we are not allowed to get. So it doesn't matter what your condition is, if you're prescribed that, you're not going to get that. It's hard because you feel frustrated and trapped in this like never-ending universe of like, but this is actually wrong, there is something there, please somebody help me.
It's a numbing experience, it's a frustrating experience.
What they need to do is understand that we're just there for their help.
I think the main solution to everything is better communication.
Differences between good experiences and bad experiences are quite small. When a doctor says hello to you before the prison officers, those little things make a big difference, because it gives you confidence that the person actually knows what they're doing and the person's treating you as a patient.
Just remember that each patient you see, although they come from prison, they have a backstory and they may have gone through horrendous trauma to end up where they are today. And actually coming to the hospital might be the first step in them actually rebuilding their lives and changing to have a better future and become normal members of society.
We were doing some evaluation of the animation just before COVID hit. So initial responses were it's very effective in changing people's behaviour, but we need to kind of pick that back up once we're allowed to see people. But that's it from me. So I'll hand back to Ruth.